Here's a shocking twist. A state's effort to tie Medicaid access to work requirements has spent twice as much on paperwork as on actual health care. But here's where it gets controversial. The same program, championed as a solution to reduce government waste, is now accused of creating a bureaucratic nightmare that leaves low-income workers without coverage and corporate consultants with fat paychecks. And this is the part most people miss. Georgia's Medicaid overhaul isn't just a local issue. It's a blueprint for policies shaping the future of healthcare across the U.S., and it's sparking a fiery debate about who truly benefits. A recent report from the U.S. Government Accountability Office, GAO, reveals that Georgia's Medicaid work reporting program, known as Georgia Pathways, spent $54.2 million on administrative costs, compared to just $26.2 million on direct healthcare services between 2021 and mid-2025. That's a staggering imbalance, with administrative costs still dominating at 58.8% of total spending as of 2024. Critics argue this isn't efficiency, it's a system designed to exclude. The program, which requires able-bodied adults to log 80 hours of work, classes, or community service monthly to qualify for Medicaid, was part of a broader push by Republicans to impose similar rules nationwide under the Trump administration's Big, Beautiful Bill. Georgia, however, became the only state to fully implement these work mandates. The result? A maze of eligibility checks, redundant tech systems, and legal battles with the Biden administration, all of which inflated administrative costs. Senator Raphael Warnock, a Georgia Democrat who requested the GAO report, called the program a real waste, fraud, and abuse, accusing it of barring working people from coverage while enriching corporate consultants. This report shows that Pathways is incredibly effective at barring working people from health coverage and making corporate consultants richer, he stated. Republican Governor Brian Kemp fired back, blaming Democrats for stalling the program and inflating costs. Democrats like Warnock are trying to rewrite history after 4 years of inaction, Kemp's spokesperson argued. The fallout? Millions of eligible Georgians could lose coverage as the program's documentation hurdles become too burdensome. Georgia already has the nation's highest uninsured rate and has refused to expand Medicaid to cover all adults earning up to 138% of the federal poverty level, a policy shift championed by President Obama. Instead, Kemp's Georgia Pathways limits Medicaid to adults earning no more than $15,650 annually. Yet despite these restrictions, enrollment remains dismal. A year after launch, only 4,300 people were enrolled in the new program, with numbers rising to 6,514 by spring 2025. Republicans defend the low enrollment, claiming Medicaid should be a temporary safety net for those who can eventually secure employer-provided insurance. But health policy experts like Joan Alker of Georgetown University's Center for Children and Families argue the program is a wasteful system of red tape that prioritizes corporate profits over people. Spending taxpayer dollars on consultants to build complicated systems that keep people out of healthcare is one of the worst uses of public funds I can think of, she said. The GAO report also highlights that nearly 90% of Georgia's administrative costs came from federal funds, with an additional $20 million in federal grants used to streamline the application process. Despite these investments, the program's complexity persists. This year, more spending is planned for publicity, staff training, and system upgrades, efforts that critics say will still fall short of addressing the core issue, accessibility. In a surprising twist, Kemp recently proposed allowing low-income parents with young children to bypass work requirements, a move requiring Trump administration approval. This partial rollback hints at the program's fragility and the growing recognition that its current design may be unsustainable. So who's right? Is Georgia's Medicaid overhaul a necessary step towards self-sufficiency or a costly experiment that undermines healthcare access? Share your thoughts in the comments. And while you're at it, consider this. If a policy is so complex that it requires $54 million in administrative spending to function, is it truly serving the people it claims to help, or just enriching the consultants who design it?